So on a typical day for me, today's actually not as bad of a day for me, but on a typical day, I would say on a pain range from 1 to 10, I'm usually around 7 or 8. My neck will spasm uncontrollably to the point where I'm not even able to drive to work. I've had days where I've had to be rushed to the ER because the pain was so unbearable that I was exhibiting traits, I would say, closer to somebody of Parkinson's or even Tourette's. And I can feel right now there's some strain in my neck. I have the tendency to pull it back. And even when I'm not necessarily pulling it back, it's just really tight and strained. But as soon as I put that appliance in my mouth, I felt instant relief. Something that I want every single day but don't get. So I'm hoping that, you know, with the continued use of the appliance, it will eventually minimize the painful effects and the annoyance of having my neck move like that every day.
We're here today with my patient Ashley to seat an intraoral orthotic which we had made in order to treat her cervical dystonia. Ashley's been suffering with cervical dystonia for about a year now, is that correct?
Yes.
And she has had a hard time getting relief. She has been on some medication which did help her to some extent. We had Ashley in the office about 3 weeks ago, and at that time we did an evaluation. And from the results of that evaluation, we designed an orthotic appliance to treat her cervical dystonia. As you can see right now, you know, Ashley has the symptoms of cervical dystonia, which include neck movements that are beyond her control without medication. So Ashley, tell me, we did send her home with a temporary appliance. Has that been beneficial for you?
It's been extremely beneficial. It's pretty much been a night and day experience. I can wear it when I'm driving. I wasn't able to even drive to work before my fiance had to drive me to work because the spasms were so bad. I get a couple stairs, but it's allowed me to drive to work, get through work, and also sleep at night. I'll wear it at night and it helps me fall asleep.
So our goal today is to seat this appliance and get it adjusted to the correct vertical dimension in order to alleviate Ashley's symptoms. You good?
Mm-hmm.
Okay. Go ahead and close. Just let that settle in for you. Let's see what kind of response we get. And Ashley, I would expect that you would be able to feel when that appliance is going to be at the correct vertical for you.
Mm-hmm.
Do you feel that that is close to where you were with the temporary appliance?
Yeah.
Okay. It looks to me like you're relaxing already. Is that an accurate assessment?
Mm-hmm.
Wow, that's pretty good. Try that. You feel the right side in contact now?
Uh-huh.
Okay. What's really nice about these orthotics is they can be used not only to treat cervical dystonia, they can also be used to treat symptoms of Tourette's and of Parkinson's disease. So they're very effective for all types of motion disorders. As you can see now, Ashley looks more relaxed. She doesn't have as much tension in her neck. You know, she's not tending to tip back like she was earlier. So we're going to mark it again and see if we're getting close to being more even on both sides with the contact area. Okay, so we have one contact on both sides. So I'm just going to continue to adjust this until I can get more even contact on all of her posterior teeth on both sides. We'll have the relief.
Mm-hmm.
Go ahead, you try that.
It feels good.
Feels good there?
Uh-huh.
See, I may let you go with that and have maybe, next time you're in town, we'll have you back in, and, if we can adjust it a little bit more. We want to close you as far as we can while maintaining, alleviation of the symptoms.
Mm-hmm. Yeah, I don't feel like I need to move it at all.
Okay, wonderful. I'm not going to mess around with it too much then. You can see the appliance. In Ashley's case, the appliance had to be made pretty thick. I think we opened her up about 9 millimeters anteriorly, which is a significant amount of opening. But that's what worked for her. So we're going to, at this point in time, let Ashley sit here with it for a few minutes, and if she's comfortable, we'll send her home with the appliance and bring her back when she is back in town, and we may want to adjust this a little bit more. I would love to be able to close her bite a little bit more with this appliance, but that's going to depend on her and how she reacts to the appliance and what her symptoms are as time goes on. You try.
I'm so relaxed.
So it seems like the right spot for you?
Mm-hmm.
Okay. We're going to let Ashley take this back with her to her home, and she's going to use it as much as she can. She's going to have to practice enunciating with it, but as you can hear, she is speaking fairly well. Unfortunately, we have her open significantly, and it's obvious. But if it alleviates her symptoms, then that's where we'll keep her for now.